and then most medications are contraindicated by. Hi everyone, welcome back to my channel, or welcome if you're new here, welcome back to another video. Today I'm super excited to finally be sharing with you guys how to get an A in pharmacology. Whether you're in nursing school or whether you just happen to take the class, I really hope this video will help you guys. If you don't know who I am, hi. I have just finished my second year of nursing at the University of Ottawa, so I'll be going into my third year in the fall in my Bachelor's of Science in Nursing program, and I've just been documenting my journey here on YouTube. So I'd love if you guys would join our little family, hit the subscribe button, and see where this journey of mine takes me. I do film quite a few study videos, and I really like to get the videos out before the school year starts. Me personally, I don't start until September. However, I know there are a ton of people who are either in summer classes right now or who even start as early as July, so I wanted to get this video out as soon as possible. I have actually had this video be requested to me since before I even took the class. So this time last year is when people started to message me asking if I could make a video about pharm, but I didn't take the class until this past winter semester, the one that I just finished last month, and so I really couldn't just film this video because I didn't know what to talk about, obviously. Throughout the semester I was doing well in the class. I just wanted to wait for me to get my overall mark and have everything on the transcript just so I could really feel like I was well equipped and had the actual credentials to talk about it. But now that that's all settled, the marks are final and everything, I figured why not hop on and film this video. So I do have a Starbucks refresher, and I encourage you guys to go, I don't know, get a I encourage you guys to go get a glass of water, coffee, whatever you want, chill, and let's get through the video together. I also happen to have all my tips written in the notes app on my phone, so if you see me looking down, that's what I'm looking at. Also, if you've seen any of my other study videos, I have the pathophysiology one, the A&P, and the fundamentals, and I will link those down below in a playlist so you can go watch them. But if you have seen them, you might hear me repeat a few tips for this class that maybe I've said for patho or whatnot. And the reason for that is I really just have the same core principles that I apply for the majority of my classes, and then I build on those in a way that's specific to the class, if that makes sense. So if you hear any repeat of tips, that's why. But without any further ado, let's get into the tips. So I actually had pharmacology online with COVID. I know a few other people's schools were already starting to open up and people started going to in-person classes, but mine was strictly online. So just keep that in mind when it comes to studying. I wasn't really able to do certain things that maybe I would have done if I were in person, but for the most part, these tips can apply to anyone, whether your course is online or whether you're in person. First things first, my favorite website that got me through pharm is drugbank.com. I believe I'm saying it right. If I'm not saying it right, I'll just put it on the screen, but this website is literally so helpful. It has like everything on there, like the type of drug, the mechanism of action, contraindications even. It has so much on there, and it helped me a lot, not only in pharmacology, but also when I had to make my medication sheets for clinical. This website just came in so clutch. It has everything on there. And so if you're ever studying and there's a medication that you kind of want to know more on, I definitely would recommend going on this website and looking into it. It's just so nice. And sometimes you just want to read information in a different way than, let's say, it was presented to you in your class PowerPoint lectures or than your textbook, you know what I mean? So I really like this website for that. So I definitely recommend adding that into like a little bookmark on your bookmarks tab in your Safari or your Google Chrome or whatever you use, because it was definitely a site that I visited frequently. So my next tip is, if you've seen my other videos, then you probably would have seen this one coming, but that is to use flashcards. So I'm not really big on using physical flashcards, and I never really was. I don't know why. I feel like physical flashcards, one, is just so time consuming, and two, I feel like I just find it so boring. So I choose online flashcards, and I actually like to use Quizlet because Quizlet can be interactive, and they've started adding a bunch of features where, you know, it'll create practice tests for you, and it actually keeps track of how many times you get a flashcard wrong or how many times you get it right. And then if you're getting it wrong a lot, it feeds it to you more. If you keep getting it right, it kind of puts it in the back burner. So it's just so nice. I used it all throughout first year and even second year. Even for classes that are not like heavily memorization based, flashcards really help. I really like online flashcards because if I'm commuting on the bus, I can look on my phone and I can study, or if I'm in the office and I have some downtime, I can study like that on my computer. It's just nice. And I feel like with pharm, it's a lot of memorization. Of course, you have to understand the mechanism of action, but there's also a lot of memorization, and then Quizlet just helps you kind of get through that all because you're doing active recall, which is very efficient when it comes to studying. So although you don't have to do online flashcards, I definitely feel like it's a lot more effective, at least for myself, and I know a few other people too. However, physical flashcards work too. I know for the people who do do use physical flashcards, that's their go-to. So if that's what works for you, that's great, but flashcards in general are super, super helpful for pharm. My next tip, and this is something that I say all the time for literally every single class, I don't care if you're in nursing school, I don't care if you're in community college, university, or whatever, but that is distributive practice. Distributive practice is the best way to do good in all of your classes, okay? I guess the name kind of gives it away, but it's just to practice distributively. Like, don't wait until the night before your exam to study. Basically what I do is I study after each lecture and I make my flashcards right after each lecture, and then I'll go through them one time. And then over the week, I'll kind of continue with lectures, and then I'll repeat and I'll repeat. And then, you know, 2-3 days before the exam, I'll go over the terms that I've missed a lot or things that, you know, concepts I'm confusing and stuff, and then I'll focus on those. And then that way, when it comes to the exam, you're not cramming, you've had a lot of exposure to the material, and you basically feel prepared. And that's honestly like the best thing you can do. Just spread out your studying. I promise, like, it's so much worth it. I know it might seem annoying to study pharm like every day or study pharm 3-4 times a week, especially when you have work and you have other commitments, you have other classes, but just spreading out when you study can make a huge impact on your grades and a huge impact on how you retain information and then how well you recall the information. So distributive practice is definitely a must, especially when it comes to pharm. So my next tip is, I don't even know what this would go under, but I guess classify like drugs and then study them together. So for example, in my pharmacology class, we had a bunch of drugs that you'd use for the HIV treatment. And so I classified them all under one little flashcard, one slide, and it helped me remember them that way. If you kind of have a lot of drugs, like for example, if you have anticoagulants, study those, put them all under one slide. If you have antihypertensive drugs, study those. Drugs used for HIV treatment, study those. I feel like when you separate them based on what they're for, it helps you recall a lot easier. And a lot of those drugs will kind of have similar suffixes, I think is what it's called, like the end part, like metoprolol, bisoprolol, all those, like they end the same, so it's easy to remember them. So that definitely helps. So I guess this tip would be to like study drug types or like the class of drugs together instead of confusing yourself. And then once you've mastered going by each drug type, then start studying it per system. So like if you have chemotherapeutic agents and then you have drugs for the cardiovascular system, etc., going by systems is really helpful too. It's something I've always done, even for pathophysiology and for anatomy and physiology. Going by system is just like, it makes sense. And also in my nursing school and like my nursing program, you do pharm after you've done your patho and 3 A&Ps. So at this point, I feel like studying system by system isn't really that overwhelming, at least for myself. So if you can also study drugs per system, that's also a great way to stay organized in your studying for pharmacology. My next tip, and this is one that I say all the time, but it's just so helpful, and that's to use a dry erase board. Okay, so I don't have mine with me right now, but I just have a mini dry erase board, and then I also have a bigger one. And what I would do is whenever I was studying, I would write out the drugs over and over again, and then try to write underneath like side effects, mechanism of action, etc. I'm just somebody who I'm really like tactile. I need to write things out, draw things out, make diagrams, whatever. So that's why I like to use dry erase boards, because you can write it over and over again and then just erase it, go again and again, and you don't have to waste paper either. So I just got my mini dry erase board from the dollar store, and mine is small enough that I could actually put it in my backpack and take it to campus with me. So that's why I like that, because then I could do easy studying on the go. It's just a really nice tip. I know a lot of people have iPads now. I have an iPad too with an iPad pencil, but I still think I would stick to the dry erase board, but it's kind of whatever you would prefer, you know. Okay, my mouth is getting kind of dry. That's much better. Next tip, have a good study group or a good study buddy. So I was actually in this big like study group kind of thing, and people were always helping each other out, asking questions in there and sending like practice questions and stuff like that. So the school actually has little study groups, at least my university offers that, so you can go to those. I didn't really go to those though. I would just go with my own study group that I had in like that big group, but do whatever works for you. I know if you don't really know people, then it's kind of just better to go with the study group sanctioned by your school. And another benefit of going to the study groups from your school is that usually the students who are leading it are students who've already taken the class, so they kind of know what to prepare you for. I think I went once or twice for like midterm reviews, and they'd give you practice sheets, and those are actually really helpful for review and stuff. So just honestly finding good people to study with, whether that's going into a study group run by your school or studying with some friends via Zoom, in person, whatever, it really helps. And my next tip, kind of going off the previous one, is to ask questions. My professor actually had a discussion forum where students could ask questions, and students did and that. But me, myself, I like to just email the professor directly. I feel like sometimes it's easier because I'm not very good at wording my questions, and I don't want to confuse anyone by posting it on the forum. Like, it's very true. Sometimes my sentences don't make sense because I get very overwhelmed very easily, and then I freak out and then nothing makes sense. So I usually just email my profs. I also texted a bunch of people in my class all the time asking about this and that and whatever, and people were super helpful. So just ask questions. Don't be afraid. Your professors want to help you. Your peers want to help you for the most part. And I don't know, I feel like it's just, if you have the resources and you can ask people, why not? You know, why not? Especially people who are already in your class, because sometimes the way the professor explains something to you doesn't make sense, but then the way your classmate explains it to you can make sense, and then you'll understand the concept that you were struggling with. So ask questions. You literally don't lose anything. My last tip, and this is, I guess this might be a controversial one. Earlier in the video, I mentioned distributive practice. So yes, I'm saying to study, you know, let's say 3-4 days a week. Yes, I still stand by that. But I want to make it clear that when I say study a few times a week or whatever, I'm not saying sit the entire day and study that one class. I know people can study for like 7 to 8 hours a day, and honestly, I get comments of people being like, wow, you're so study-ish, like you probably have such a great GPA, like wow, you study so much. And in reality, I really don't study that much. I maybe will study like 2 hours a day. I don't study a lot, okay? Because somebody like me, I have anxiety and I'm very hyperactive and stuff. I can't study for extended periods of time, and honestly, you don't need to do that. You don't need to study harder, you just need to study smarter, and you just need to be efficient with your work. That's it. Some people need more time, they don't mind spending the whole day studying, but I personally can't do that. I work out, I have a lot of stuff going on, and it's not realistic for me to study the entire day. I also get lazy as time goes on, and then I'm not as efficient. So instead, study a few hours, like be efficient with your studying, and that's it. Don't punish yourself, because at the end of the day, like, you're just gonna hurt yourself, you know what I mean? Like, there's such thing as overstudying and burning yourself out, and especially when you have other commitments and other classes, you want to make sure that you're, you know, staying organized and allotting the correct amount of time for everything, including self-care and stuff too, you know? So you don't need to study all day. You don't even need to study every day. As long as you're efficient with your studying, that's all that matters. So I just kind of wanted to like end it on that note, but that is it for my study tips for pharmacology. I wanted to actually share a couple like tips on studying smarter, as I just mentioned. So I'm on this website called leveluprn.com. I will also link that in the description box below along with the drug bank one, but they have a few tips on here, so I figured I would just go on and tell you guys what these tips are, just in case you stuck around to the end of the video, and then you don't have to go on the website and read it. When in doubt regarding a food interaction, go with grapefruit juice. When asked about a common side effect, go with something like GI upset or headache, not something serious like seizures or urinary retention. Medications that end in son or sun, however you want to pronounce it, are typically steroids. So know the side effects of steroids, like bone loss, weight gain / fluid retention, hyperglycemia, hypokalemia, infection, and peptic ulcer disease. Herbal supplements like garlic and ginger often cause the increased risk of bleeding. Medications that end in MAB or NIB are immunosuppressants that are often used to treat cancer and autoimmune disorders. And then most medications are contraindicated by pregnancy. I feel like this is pretty commonly known anyway, and you just kind of assume that your medication is contraindicated by pregnancy, but that's just something to remember. And also just assume that it's not advised to drink alcohol on the medication. Like, I just always assume it's not advised. Anticoagulants, antiplatelets, and thrombolytics should be used cautiously in patients with peptic ulcer disease, recent surgery, and intracranial bleed, due to the fact that these obviously increase your risk of bleeding. And then obviously in general, patients should never just discontinue their medication abruptly. Like, I feel like the biggest thing for this is if somebody is prescribed antibiotics for a 10-day course and then their infection is gone or whatever is gone on the 6th day and they just kind of stop, like, that should never happen. And I feel like we need to make it clear to our patients, like, don't just stop it because you feel better. Go until all your meds are done. Do not chew / crush extended release capsules, and then apply transdermal patches to hairless, intact skin. I guess that's basically it. There's like a little section on here for vaccines and stuff like that too. We didn't really talk about vaccines in my pharmacology class, so I'll just leave that be. If you do want to go read on it, you can go click the link. But those are basically all my tips on how to get an A in pharmacology. I personally did great in the class, and I'm really happy about that because I was definitely terrified going into the semester because I've heard so many things about pharmacology. Personally, I really enjoyed the class. It was actually pretty interesting, and I found it to be easier than pathophysiology. So if you're in patho right now and like you're stressing about pharm, in my opinion, pharm is so much easier, but it definitely helps if you do well in patho before, because I feel like it just helps you understand like the mechanisms of the drugs a lot easier. But I hope this video was helpful, and I hope you guys were able to take away at least one thing from this video. If you guys did enjoy this video, please do give this video a big thumbs up. It helps my channel get into the algorithm and it recommends my video to more people. And if you haven't already subscribed, then please do so. Join my little family, see where the journey of mine takes me. That's all from me. Thank you guys so much for watching, and I'll see you guys in the next one.